Hello, my name is Brian Ramacco, and today we're going to be using a Suresult D3 Ultra to evaluate for a lateral ankle sprain, an inversion sprain. What structure is most likely to be injured? Well, what's going to happen is you're most likely going to tear the ATFL, right? The anterior talofibular ligament. And so that ligament is going to go from the fibula to the talus. And a lot of people think, oh, it's probably straight down somewhere. But in fact, it goes almost like across the foot. So it's basically from the lateral malleolus. Sometimes it's angled a bit more towards the big toe. Sometimes it's actually even more medial than that. You may have to adjust your transducer. But it can be sort of almost like across the foot. So it's much more across the foot than you think. And if you have a high frequency probe, and the Suresult goes up to 10 megahertz, which is plenty for this particular structure. And it's nice to have the patient being able to, or for you to be able to manipulate the foot to check for laxity of the ligament. So, and to see if it's still connected. Like if you move the foot and it doesn't become taut, that's a problem. And you may want to use split screen to image both the asymptomatic side and the symptomatic side to see if the laxity looks normal and the echogenicity looks normal. So let's just take this image real quick. Right, we're looking to see if it's extra lax, we're looking to see if it's abnormal echogenicity, and we're looking to see if it's torn. So again, lateral malleolus sort of going across the foot. And that's it right there. So it's this structure right there. And that is normal echogenicity, and that already looks quite taut, even though her foot is relatively in neutral. And of course I can do dynamic imaging, so I can try to image it again. I can make sure that it stays taut, or it becomes taut as the foot moves. You may have to adjust your transducer to stay on the ligament. But this is useful in the case where it looks a little bit lax and you're worried that it's a complete rupture. And if it moves, if it becomes taut, then you know it's not a complete rupture. Anyways, that's it. So you can evaluate how bad the ankle sprain is very quickly with an ultrasound unit. I hope you found this useful. Cheers.